Good morning, everyone. Thank you for attending this HICAP presentation on Medicare and preventive benefits under Part B of Medicare. My name is Bob Gibney. I'm a HICAP counselor, a volunteer counselor. That's what I spend most of my time doing in terms of my work with HICAP, and I occasionally do what we call community education presentations, this being one of them. I will share my screen here and we can get going on the presentation. Okay, can everybody see the slides? Good. All of you appear, or most of you actually, I can see you on the right side of my screen. There aren't so many that it blocks the slides, so I'll leave those up there. Although, as Alice said, the best way to communicate to me during the presentation is to type something in the chat. Alice, I'm sure, will keep her eye peeled for raised hands. You guys know about doing that, I assume. It'd be one of these things. You see, hopefully, a hand raised on my slide here. Yeah. So that's another way to communicate, and we can pause at any time. This can be very informal. I'll also take any questions you have at the end of the presentation. And if we don't get to answer all of your questions, let me right now type my name and my email address in the chat.
And I pinned you, so they might only be seeing you and the slide.
Okay. There, did my test chat go through?
Yes.
Great. Okay. All right. So this the presentation is broken down into three parts, and I didn't prepare this. This was prepared by a staff person at LAS HICAP. The first part, I'm going to briefly describe HICAP, what it is, LAS HICAP, and what we do. Then there's going to be a brief overview of the structure of Medicare Parts A, B, C, and D. And then we'll get into the specific preventive benefits. As Alice mentioned, each one of you will receive a copy of the slides and the recording if you care to view it again, but more importantly, the slides. There is a lot of detail included in the slides with respect to specific preventive benefits, what they're comprised of, who's eligible for them, whether or not there are any copays involved, and so forth. So don't worry about taking notes. I'm going to run through this stuff relatively fast, given the limitation we have on time, but you'll get the slides later. And I'm also going to recommend this booklet published by Medicare. It's 27 pages. It's entitled Your Guide to Medicare Preventive Services. It was published and updated in March of this year, so it's very current. I will send Alice a link to that booklet that you can access for all of the details that I'm going to include in the slides today and briefly review during the presentation. But that's a great resource material for all of the preventive benefits, and something I urge you to keep for future reference. You can also order a copy from Medicare, hard copy, if you'd prefer to do it that way. Okay, so first part, HICAP. We provide assistance with Medicare and related health insurance to anyone who requests our help with regard to their benefits and their options in choosing how to supplement Medicare. We also do a lot of work. Let's see. We do a lot. I'm trying to advance the slide here, Alice. Don't I just hit? I'll do it at the bottom over here. Okay. LAS and HICAP receive substantial funding from both the federal government and the state of California. Medicare, CMS, Centers for Medicare and Medicaid Services, recognized years ago that the system was so complex that people needed help navigating the benefits offered and making choices. So CMS, Medicare decided to fund all over the country local HICAPs. We're organized by county, and we also have private donations to support our services. All HICAP counselors are trained and registered with the state of California, and we have annual continuing education requirements. We counsel at over 30 locations throughout Alameda County. Since the pandemic, we've offered phone counseling. It was only during phone counseling during the pandemic, and both counselors and people desiring our services have generally found it much more convenient to have counseling done over the phone. We can also do it via Zoom if you prefer. And so these 30 locations are sometimes not staffed at all anymore, but most of our services are actually provided over the phone. We also provide educational presentations on various topics like the one you're attending today. And finally, if we have difficult cases that require extensive follow-up and some real advocacy, we can refer those cases to the Legal Assistance for Seniors legal department, and they will pick up where the HICAP counselor left off. All of these services are free, and we have no maximum income or asset limitations like some services require, focused on people most needy from an economic point of view. There are no economic criteria to get HICAP services. Okay. What is Medicare? So this is our part two. We're going to quickly go through this and to orient you and give you kind of a grounding. I'm assuming that everybody on this call is probably on Medicare. If you're not yet on Medicare and you have specific questions about the application process, we can deal with those at the end of the program. But I'm going to assume that otherwise, all of you already have Medicare. So we'll make this part of the presentation relatively brief. You're entitled to Medicare if you're a U.S. citizen or legal permanent resident for 5 years or more, and you're entitled to it under two circumstances. One, when you turn 65, which is how most people get Medicare, and more recently, or that is actually 10 years after the original Medicare was adopted in the mid-1960s, Congress added Medicare for disabled persons under 65. You're entitled to get Medicare if you have a disability recognized by Social Security, in other words, diagnosed as a permanent disability, and you've been collecting Social Security disability income for 2 years. There's an exception to that 2-year waiting period. If you have kidney failure or ALS, there is no waiting period applied. And the note at the bottom, you've all been through this, you apply for Medicare through Social Security. You're automatically enrolled in Medicare when you turn 65 if you're collecting Social Security. If not, you have to apply yourself with the Social Security office, and Social Security also handles the billing for your Part B premium, which I'll get to in a moment. That's all Social Security has to do with Medicare, the enrollment and the billing. All of the Medicare services are implemented by CMS Medicare. So Medicare handles everything after you're enrolled other than the billing. There are 4 parts to Medicare, the alphabet soup of Medicare. Part A and Part B are the original Medicare, and they're often referred to as original Medicare. Part A covers inpatient services in a hospital. Part B essentially covers everything else that Medicare covers. Doctor visits, lab work, imaging, durable medical equipment, ambulances, everything else is covered under Part B, if it is covered. I'll get to that in a moment. Part C, many of you, I'm sure, are enrolled in Medicare Advantage plans. Medicare Advantage plans are all structured on the HMO model, Health Maintenance Organization. So they have networks of providers and hospitals, and you must stay within the network in order to have your insurance coverage effective. There are about, I had some notes here, but I can't remember them. There are about 90 million, no, that's not correct. There are some 65 million people enrolled in Medicare currently, and almost half of them are enrolled in Medicare Advantage plans. Medicare Advantage plans are private insurance programs that these insurers contract with Medicare to provide these Medicare Advantage plans and effectively take over Medicare's responsibilities for providing your services under Parts A and B. Medicare Advantage plans can also provide additional services. We'll get to that in a little bit, but most of the time, the most important ones, provisions of greatest interest to people involve dental, vision, and hearing coverage. Some of it's provided automatically as an enrollee in the plan. The plans, most of them also offer additional dental, vision, and hearing coverage if you're willing to pay an extra premium. Medicare Advantage plans also cover your prescription drugs, which gets me to Part D, prescription drug plans. In 2006, Congress provided for prescription drug plans. Before that, Medicare, neither Medicare nor Medicare Advantage provided any drug coverage. So that was a big hole in coverage for many, many people. Those plans are also offered by private insurance companies. And if you're enrolled in a Medicare Advantage plan, you don't need a Part D plan. In fact, you cannot enroll in a Part D plan. It's either or. If you supplement your Medicare with something called Medicare Supplemental Insurance, sometimes called Medigap, then you do need a prescription drug plan to go along with the Medigap. Part A is premium free if you've been paying the FICA, F-I-C-A Social Security tax for 10 years or more. Most people are entitled to Part A without premium, and they can be based either on their work record or their spouse's work record. If you don't have 10 years of payments into the Social Security benefit system, then you are liable to pay a premium. It's shown at the bottom of the page here. If you have 30 to 39 quarters, but you haven't got 40 quarters, it's a certain amount, and fewer than 30 quarters, another number. As I said before, very few people pay for their Part A. I'm going to skip all of the text on the top here. That's about enrolling in Medicare. As I said, I'm assuming you all are enrolled. The bottom couple of lines, however, is important. Part B, everyone pays a premium for Part B. At a minimum, it's $164.90 this year. That premium changes a bit every year, mostly going up. No surprise in that. One year recently, it actually did go down. Under Part B, there are two costs in addition to your premium that you pay monthly, and that is an annual deductible of $226. Not a huge amount, but that's applied annually each year. You have to pay the first $226 of your medical costs before Medicare coverage kicks in. The bigger factor is the 20% copay. You won't face this copay if you're enrolled in a Medicare Advantage plan. They restructure the economics of Medicare. They get rid of the copay as a percentage and apply instead a fixed copay depending on the type of service you get. It might be $20 for a primary care doc visit and $35 for a specialist or whatever. That number varies by plan. But that 20% coinsurance number is a big number for outpatient services under Part B. This is a complicated table. I won't spend any time on it except to say that if you're an individual with adjusted gross income over $97,000, or a couple with income over twice that, 194, then you pay more for your Medicare Part B. It's like the Internal Revenue Code. The more money you make, the higher your tax bracket is. And so the same is true for Medicare Part B. Again, well over 90% of people pay the minimum or the base Medicare Part B premium of roughly $165 this year. Part B coverage, I said earlier, it's everything outside the hospital setting. So doctor visits, all diagnostic tests, rehab services if you've had an injury and need physical therapy or occupational therapy, durable medical equipment, wheelchairs, medical beds, breathing devices, walkers, and so forth. It covers all ambulances. Well, it covers ambulance care as needed. Ambulances, that's an area I pause here because it's where the most disputes come up under Medicare. It's important to know that you must really need an ambulance before one is ordered. It has to be medically indicated, and you have to show that you could not safely have gotten to the hospital or your doctor or wherever you're going without an ambulance assisting. Part B covers mental health visits, and as I noted here, the occupational physical therapy. We'll get to preventive benefits shortly, and most of those benefits come without cost and without any showing of medical necessity. That's not true under Part B. Part B has the 20% copay that I mentioned. In addition, most Part B services have to be ordered by a physician on the basis of their being medically necessary and reasonable for your particular healthcare. That's Part B in a nutshell. Now, diagnostic care is one of those Part B services. It covers the kinds of things that I mentioned earlier. I think we can probably skip this one. This is an important place to spend a few minutes. Medicare does not cover certain things at all. I mentioned it didn't cover prescription drugs until Part D was introduced in 2006. It doesn't cover any of these services. And the most important exclusions are the top three: routine dental, vision, and hearing care. As I said previously, if you're enrolled in a Medicare Advantage plan, you can get some modest benefits for in this area. You can also purchase individual plans to cover dental and vision in particular. I think there are plans also available for hearing. That's also private insurance to plug the gap that Medicare doesn't cover. And there are several other things listed here that are not covered by Medicare: routine foot care, cosmetic surgery, experimental procedures. And the last item, unfortunately, personal care at home or in a nursing home. There have been many proposals over the years for Medicare to be expanded to provide what is called long-term care. And ideally in the home setting where most people desire to stay, if that isn't safe for a person or otherwise is ill-advised medically, a nursing home. So that's excluded altogether from Medicare, a big gap. Hopefully that will be plugged sooner rather than later. There have also been many attempts to add dental and vision to Medicare, but thus far those have not succeeded either. Write your congressperson about that if you're so inclined. Okay, preventive care. Maybe we could pause here, Alice, because this is the sort of the meat of the presentation. Are there any questions yet?
There actually was a question right at the start. It says, if in a senior facility where you pay for med management, weight, and blood pressure due to medical issues, and/or help with oxygen management. Is any of that covered by Medicare? And if so, how does one initiate that?
Let me just quickly go to the chat again and read that.
It's right above your email.
Yeah, let me get to the, how do I get to the chat? Let's see. Oops, I'll keep advancing here, but I want to get to the.
So along the bottom of the Zoom, that's where, if you don't have chat listed under more, usually you can click on the chat and it opens a separate box.
There it is. I see it at the top of my screen. So, okay, so if in a senior facility where you pay for med management, I'm assuming that, Sherry, you meant senior facility as in a nursing home or assisted living facility?
That is correct.
Okay. And you pay an additional fee to the facility for your prescription management, weight and blood pressure. Oxygen management. I don't think that any of those are frankly covered by as preventive care for sure. And they would therefore be covered by Part B if you have a doctor's order requiring that your medications be managed. That's often the case for people with cognitive issues who need help doing that. Weight and blood pressure, help with oxygen, those would all be things that would be the subject of a doctor's order, and appropriately so if you need them. And those would be covered typically under Part B, subject to that 20% copay. If you have original Medicare, you'd have to check your Medicare Advantage plan if you have a Medicare Advantage plan to see the scope of coverage there. But they should be covered with a doctor's order in most cases.
Okay, does the doctor have to specifically put that on the order, like it needs to be managed?
I think so, yeah.
Okay,
Yeah.
but I could check with who I'm with now and the Advantage plan, because I'm actually asking for my mother. I'm older too, but I'm asking, trying to figure out her situation is why.
Okay, yeah, you should talk to her primary care doctor.
Uh-huh.
I would assume maybe it's a specialist like a pulmonologist or something for oxygen management, but I would get a doctor's order so that it's been determined to be medically necessary under Medicare Part B or under the Medicare Advantage plan.
Okay, perfect. That kind of answers it. Thank you for answering that.
Okay, you're welcome. By the way, if any of you have specific questions about your personal situation, or as Sherry had about a relative, we can best handle those probably at the end if we have time. Otherwise, I'm happy to get back to anyone who would like me to contact them to have a personalized session. Anything else, Alice?
There's a new one that just popped in. I'm over 65 under my hubby's health insurance. He's still working. When do I apply for Medicare?
Okay, that was not covered in the slides I just did on Medicare. In that situation, Evelyn, you can defer your enrollment in Part B. And I take it from your question, you probably have. Medicare allows you to defer enrolling in Part B if you have coverage through active employment. And it can either be your active employment or, in your case, your husband's. If you don't enroll at 65 in Part B, and you don't have this, and you're not in this circumstance that you described, then you are subjected to a late enrollment penalty under Part B that lasts for the rest of your life. It's significant. In your case, however, by the way, I'm talking about Part B. There's no reason not to enroll in Part A. Part A is free, should be, if you or your husband have paid FICA for 10 years or more, and that can act as backup coverage to your the employer group health plan that you're enrolled in. Under Part B, you can enroll anytime during the 9-month period after your husband retires and ceases active employment. even if you retain coverage under retiree policy, that is no longer, that no longer enables you to defer your Part B enrollment. Most people don't wait and enroll during the 9-month period because that would create a gap in coverage. What you should do is enroll a month or two before your husband stops working, and you must enroll in Part B. That's the short answer. Terry, not receiving Social Security payments, Medicare is effective 8/1. Okay, so you enrolled at the Social Security office or online. You will be billed for the premiums. Typically, they're billed, I think now every 3 months in advance. You can get on a monthly billing cycle if you want. The premiums could also be auto deducted from your bank account if you want to set it up for convenience. Both B and D, is that correct? Well, if you've enrolled in a Part D drug plan, then you would have to pay that premium. That's payable monthly to the insurer. It can also be set up to be auto deducted from your bank account, but that's separate and apart from your Part B premium. Social Security, I don't believe, will bill the Part D premium for insurance companies. I might be wrong about that.
Okay, I thought that you couldn't have both B and D. You had to have either or. That's
No, you can't have both C, like Charlie, and
okay,
D.
okay.
If you have C, that's a Medicare Advantage plan that covers your prescription drugs. You cannot and don't have any need to enroll in a separate Part D.
I do have a Medicare Advantage plan, so through Kaiser, so I'm not quite sure how that squares. That would be a C?
That's a C. That's a Part C.
Okay. Okay.
Have you? I hope you haven't enrolled in a Part D plan.
Well, I better figure that out.
Yeah, because you can't be in both a Part C Medicare Advantage plan and a Part D plan concurrently, the enrollment in one disenrolls you from the other. So if you enrolled in Medicare Advantage with Kaiser and then later enrolled in a Part D plan, that would terminate your Kaiser coverage. That would not be a good thing.
Okay, I don't believe I did that, but I will check on that.
Okay. All right.
Thank you.
I think that's it for now. Are there any hands raised, Alice, that more people want to?
No, there's none of those. I also want to let everyone know that we do have we have a few Medicare related community educations scheduled already. And so in November, we will be going over enrollment. So if there's a lot of enrollment type questions, we have that program in November. So
Okay.
it will be in the latest guide.
I'm very familiar with that program as well. That enrollment covers both enrollment in Medicare itself, which we just talked about with Terry, but mostly it's focused on changing your Medicare Advantage plan or your Part D drug plan. And that change can be made in the fall with new coverage effective January 1.
Yes, and that program's actually longer. We booked an hour and a half for it because it does typically take a little longer to go through all the info.
Okay, all right, let's proceed. So here, this is the meat of the program. As I said, don't worry about taking notes. You'll get the slides, and I strongly suggest you take a peek at that Medicare booklet that I'm going to include a link to Alice. She'll forward that to you, I'm sure. So, preventive care, it covers a wide variety of treatments, conditions, and so on. Basically, Medicare has chosen appropriately to provide many preventive care services and related screenings free of charge. There are some exceptions to that I'll get to as we go through individual diagnostic type items. But that's done for an obvious reason, and that is Medicare can best manage its cost, which is about $900 billion a year. Most recent figures projected to go up to $1.5 trillion by 2031. It's much less expensive for Medicare to keep you healthy and to and discover issues early for treatment than it is to wait and deal with them at a more advanced stage. It's obviously much better for you too, in terms of maintaining your lifestyle and dealing with your health issues proactively. So there's a dual benefit. So as the first couple of lines here indicate, it focuses on assessing your current health and disease prevention and helping you stay healthy in as many ways as possible for as long as possible. And examples of preventive care include checkups. We'll get to that in a minute. Most immunizations and many screenings. Let's see. Did I mean to advance that now? Yes, I'll skip back there unless they've hit something wrong. Okay, so this lists all of the things that we're going to be talking about. I'll highlight just a couple now. You see the word screening here applied to many, many different issues. Breast cancer screening, cervical cancer screening, colon cancer screening, prostate cancer screening, osteoporosis, and so forth. Those are all designed to detect issues through the screening process before you become symptomatic. In other words, before the disease has advanced to a stage where you need immediate and more intensive treatment. In addition to the screenings, the vaccines are noted down here. We've already talked about that briefly. Nutritional therapy for people, particularly with diabetes and kidney disease. We'll talk about that, and then annual exams. So let's get into the weeds here. Actually, this slide reminds me that the scope of preventive benefits are expanding every year, which is a good thing. So the most recent expansion has included a variety of immunizations, including shingles, which did not used to be covered by Medicare. It is covered now. And of course, COVID is covered now, including all boosters. So those are recent developments. Other benefits were added in 2022. They're listed here. I'll mention a couple: cognitive assessment and care plan services, mental health related issues, of course, COVID-19, we all are familiar with, opioid risk assessment. That's dealt with typically in the annual visit, the annual physical exam you can have. Hopefully, Medicare will continue to add to these preventive services every year. Okay, the first thing you get by way of preventive service under Medicare is when you newly join Medicare or enroll, it's called a Welcome to Medicare. Since you've all been through this already, I will not pause on this screen, but instead jump to the, I shouldn't say all of you, one of you was it Sherry mentioned you just are enrolled in Medicare August 1. One of the first things you'll want to do is set up your Welcome to Medicare physical exam with Kaiser soon after you become enrolled in Medicare. This just is more detail about that Welcome to Medicare initial physical screening. And then every year afterward, you're entitled to what's called a wellness visit. It's a little less intensive in terms of information gathering than your Welcome to Medicare visit upon initial enrollment, but it's something that's available. I do it every year without fail. I've been fortunate to have my doctor detect a few things for me that needed attention through that annual visit. It's highly recommended by Medicare that you take advantage of this annual wellness visit. During that visit, the doctor is obligated under Medicare standards to develop a personalized plan for your health care, and will also during that visit test you for various things, including cognitive decline. Typically, they'll also do an EKG and so forth. You pay nothing for the wellness visit every year unless your doctor orders diagnostic tests following that visit. And those tests may or may not be subject to the 20% copay under Part B. We'll get to that. Okay, now we're going to get into a very specific conversation on actual screenings, screenings in particular that are available under Medicare Preventive Services. There's a lot of detail here, as I mentioned, and there are some common themes that the slides contain. One of them is the frequency that you can get a particular screening. The other is whether or not it requires, and a few do, a doctor's order for the screening. And the third factor is whether or not you're entitled to the screening based upon risk factors unique to you. So keep those three things in mind as we go through here. Starting with cardiovascular screening. That one is covered once every 5 years. So we emphasize here that is not an annual benefit. Many of the preventive screenings here are annual. This one is not. This involves a blood test for cholesterol and other things that would indicate a heightened risk for heart attack. And you pay nothing for this visit every 5 years, or this assessment. Depression screenings. These can happen every year and typically would probably most conveniently occur during your wellness visit every year. But that's not to say that if you feel like you are entering into a depressed state, you should not wait for the annual visit. You should set up a screening with your doctor sooner than later. You pay nothing for one of these visits, one of these screenings each year. Diabetes. You're entitled to get 2 glucose blood tests per year if your doctor determines you're at risk. So here's an example where a doctor order is required in order to avail yourself of this benefit. You're at risk, and let's skip the first category. Let's go to the third bullet down there, focusing on people like you and me, namely people over 65. If you have any 2 of the following, you are entitled to have a diabetes screening. Number 1, you're over 65, so we just need to find one more. Overweight, a family history of diabetes, or gestational diabetes you might have experienced if you're a woman during childbirth. You pay nothing for these diabetes screenings if you are past these risk tests as I just went over. So over 65, overweight, family history, those are any 2 of those will entitle you to this annual pair of glucose tests. Medicare Part B can also cover therapies and training sessions, diabetes being a good example. If you are diabetic, you can have 10 hours of diabetes self-management training initially, and then every year thereafter, up to 2 hours follow-up refresher training. The training is designed to manage your diabetes medications and other treatments. This one is subject to a 20% copay. So this one is not cost-free, and the annual deductible does apply. Just checking to see how we're doing on timing. I think we're fine. Nutritional therapy services. Here you're covered and are entitled to this benefit if you have either diabetes or kidney disease. You don't have to be on dialysis, but kidney disease would be determined by your doctor that your renal function is at a certain level where you're defined to have kidney disease. The services included here include an annual nutritional and lifestyle assessment. You can have individual and group therapy sessions, and you can we will have follow-up visits to check on your progress in managing your diet. So this is dietary focused for folks with diabetes or kidney disease. Obesity behavioral therapy. This is available to people who have a body mass index of 30 or more. That would have been determined by your doctor. And this also includes dietary assessment and counseling to help you lose weight and improve your lifestyle. There's no charge for this if you meet the BMI of 30 or more standard. Everybody's favorite treatment, of course, is a colonoscopy. You're entitled to a colonoscopy every 24 months if you're deemed at high risk. Your doctor would have confirmed whether you're at high risk for colorectal cancer or not. If you're not at high risk, then you can get this test every 10 years or within 4 years of a sigmoidoscopy, which is a less intensive colon and intestinal exam. You pay nothing for the basic diagnostic test. If something is found and removed, the example at the bottom of the page here, during a colonoscopy, if a doctor finds a polyp, they will routinely remove it if you've consented to that before the procedure. The removal treatment of the polyp is subject to a 20% copay as a service under Part B. And again, when I refer to these copays, I'm talking about folks who have original Medicare and not Medicare Advantage plans. The Medicare Advantage plans, as I mentioned, reprices all of this stuff, and the 20% copay is not applicable. Mammograms. A baseline mammogram, for women between 35 and 39, these age things here keep going down as more research indicates higher risk for people at younger ages. Screening mammograms are available once every year if you're over 40 years of age, and diagnostic mammograms can be more frequent. As explained in the bottom bullet, diagnostic mammogram applies if you've already exhibited signs of breast cancer. It's a more thorough exam than the screening mammogram. The 20% deductible does apply to the diagnostic mammogram, much like it would apply to an MRI scan or x-rays. However, the screening mammograms are without cost. Lung cancer. You're covered if you meet all of these conditions for screenings. This is complicated. I won't go through this in great detail, but essentially, you have to have been a fairly heavy smoker and have a doctor's order that you're therefore at high risk for lung cancer and should be screened. The screening itself can only be scheduled after you've had a counseling session on lung cancer and decided to proceed with the screening with your doctor. If you are deemed eligible based on these criteria, then there is no charge. Less extreme is just tobacco use counseling and counseling to reduce your tobacco use. You're entitled to 8 visits for smoking cessation counseling every month to help you quit. And this is also without cost. COVID-19 vaccine and most other vaccines are without copay and without the Medicare Part B annual deductible. And there are many types of vaccines, in addition to COVID, of course, that seniors are advised to get. One is shingles, as I mentioned. The other would be a flu vaccine every year. So I have completed the slide presentation actually sooner than I expected. There is a lot of material at the Medicare site. If you type in the search feature at medicare.gov, type in preventive and screening services, you'll be taken to the page that will enable you to open up this booklet that I mentioned at the start of the presentation. And a lot of other material is available for your reading on these types of services under Medicare. There are many more available and are described in that 27-page booklet than the ones I've alluded to here. One last word before we answer any final questions. The Medicare program and HICAP is heavily involved in helping folks deal with Medicare fraud. So we like to pitch this at the end of every presentation. Billions of dollars a year are lost to Medicare fraud. I mentioned before a $900 billion price tag for Medicare in 2021, the latest year for numbers. 10% of that, or 90 billion, was fraud. So it's a huge problem. And the fraud can only be detected and policed and hopefully reduced and ultimately eliminated through the efforts of insureds taking care to look at their monthly Medicare summary notices. If you see any service on there that raises a question, as in, I didn't get that treatment, I didn't visit that doctor, there may well be fraud going on. Someone has effectively stolen your Medicare identity and put through a charge for you for a service that you never received. That should be reported. You can do it online at the website indicated here, or you can simply call HICAP, and we're happy to take the information from you and do the reporting and help you deal with the fraud if you've incurred any cost related to it. These are just numbers here that you'll see in the slides when you get them for HICAP. That's an important number. I would urge any of you who want to do individual counseling to call HICAP and set up an appointment. You can usually do that within the following week if that's convenient for you. And we counsel at all times during the normal work week. And you can do that not only for yourself, but as one person asked, Terry, I think it was, you can do it for relatives. You can act on their behalf, or they can join you on the call, and we're happy to talk with both of you. Okay, that's the number to call again. And that's it. Alice, any other questions?
Most of them were, if they join late.
See, Alice, you're muted.
Oh, I unmuted. Can you guys hear me now?
Alice, are you muted there?
No. They're shaking their heads. They can hear me.
Can't hear you. Do I need to?
Okay, can you hear me now?
Let's see. Am I muted? No.
No,
be
we can
hearing
hear
you.
you.
Can
I
others
wonder-
hear Alice speaking? Yes. Okay. Alice, help me through this by sign language or something here. How do I get to hear you?
I'm gonna put something in the chat.
Can you type it in the chat? How about that?
Mhm.
Oh, yes, mute on the computer. Good point. Can I hear you now?
I'm talking now.
There you go. All right.
Yay, okay.
Okay.
All right,
you're,
so what I was gonna say is the only questions that came in the second part of your presentation were regarding the recording if they joined late and the slides and all of that. Once I get the link from him for that document that he mentioned, and then the recording has to process. So it will be in a couple of hours, I'll send the email with everything. So I'll attach the slides, anything else that Bob sends me, and then the recording, and then there's an after class survey. And then somebody else asked about making a HICAP appointment, and you mentioned that, Bob. They can call that 800 number. I did put it in the chat, but I'll put it in my email as well. And that's all of California, correct? Like if they have relatives in San Diego, they can call the 800 number and they'll be routed to their local HICAP office. Is that correct?
Yes, they can.
Yeah, so it's not just an Alameda County thing. So you can share this information with your friends.
Although Alice, I'm not sure whether that 800 number takes you just to the Alameda County HICAP or not. But anyway,
well,
you can.
I think it's based on the area code you call from, because I called for my mother-in-law and she's in Southern California, but they routed me to Alameda County because my phone number is 510.
Okay.
So I had to explain to them and they gave me a different phone number.
Okay, thank you for that insight. Okay. Normally when but by the way, I will fess up now that this was the first time I did a Zoom slide presentation for HICAP. So
Well, you did great.
keep that in mind when you fill out the evaluation. Cut me a little slack, okay?
No, I think it was great.
I'm being facetious there. Any and all comments that can improve either my presentation or the HICAP slide deck here would be appreciated. When I do these in person, we have, and Alice, are any of them done in person at San Leandro Senior Center?
We've been trying to get a HICAP counselor back in the office in person, but it hasn't worked out yet. I think they don't have the staff to send to us. So all of our trainings have been virtual like this.
Okay,
And we've kept the community education pieces online because then more people can attend and get the information, because we do have limitations in our physical space because our AC is not working properly. And so it cuts our numbers by quite a bit. So we did keep community education on Zoom, just figuring we can get the information in more hands.
yeah, and it's definitely just like the individual counseling. We found that people prefer it generally to a gathering in person, so that's good. But what I was about to say is that when I do them in person at other locations, we have a whole table of handouts. We also have, things like pens and other goodies that people like to collect when they go to these things. But I mention this because there are many, many handouts available on all of the topics that I discussed about Medicare itself, Medicare Advantage plans, Medicare supplemental plans that don't deal specifically with prevention and screening benefits. I can't give you those, obviously, because we're not in person now. But if there's any topic that you would like more information on, you can either indicate that to Alice, and Alice, you can contact Jenny, and we can send those, or you can route the request to me, and I'm happy to email you individually more information on topics of interest to you.
That would be great. And then I think Jenny's done it in the past. We can also have you guys drop off some of the pamphlets and we can leave them out in our flyer wall, because we do have quite a few seniors pick up information from there. So I'll let
Great.
Jenny know.
Yeah, that would be something she would take care of.
Okay, I'm going to stop the
I,
recording.